Hey everyone, how are you today? Jim Prusak here from the Pain PT, and I'm going to talk to you today about this concept. This is a mental concept. It's also, I guess, something you put into action, and it's really important. And it's this concept of trying versus being, all right? And the word trying really comes up with chronic pain and chronic health conditions. And it's a really interesting word because it has two meanings to it, doesn't it? It's a verb. Trying means to make an effort or make an attempt to do something. And in the case of chronic pain and other chronic conditions, we try to fix it. We try to do something to make it better. We're always trying to do something, right, to help ourselves. But at the same time, the word trying as an adjective means a difficult or unpleasant or tough time we're going through. So we can take chronic pain, we can take chronic health conditions as trying times. They're really difficult times that challenge us. But when we take the notion of trying as a verb to get out of a trying time as an adjective, it doesn't work. And I'm going to explain to you here why it doesn't work. When we try to do something to fix our bodies or fix these symptoms we're experiencing, it backfires. And the reason why is there's nothing to fix. It's like the saying, if it's not broke, don't fix it. There's nothing broken in our bodies with TMS, PPD, mind body syndrome, MBS. There's nothing to fix. So if we're trying to fix something that's not broken, it won't work. And I see this all the time with people who come to me and people I talk to. I ask them, what have you done? What have you tried? And they give me a list of physical treatments they've been through, and they haven't been successful or only helped a short bit or a little bit. And that's because they're barking up the wrong tree. They're trying to fix something that's unfixable. It's not broke in the first place. So when we move from this state of trying, of this effort, of this attempt to change something, we move from the state of trying to the state of what I call being, which is a state of living and being okay with what's happening. It changes things. And that's when I see people, when they've stopped trying, they've tried everything, and they come to me and they're ready to stop trying, and they're ready to start living and being with what's happening in themselves. They're ready to start being okay with whatever's happening because it's just a manifestation of the brain and nervous system, of the mind, which is thoughts, feelings, emotions, beliefs, habits. This is not a serious condition. It really isn't. So we don't need to fix it. There's nothing to fix. That means we can give up trying. We can give up this attempt or effort to fix it. It takes a tremendous pressure off ourselves. And I really want to come back and drive home this point that you're okay right now. You're okay right now. You're not okay tomorrow. You're not okay a month from now. You're not okay a year from now. You're okay right this second. There is nothing structurally, physically wrong with you. You are not damaged. I really want to drive home this point. And if you can take this message that you're not damaged and there's nothing wrong with you, that means there's nothing you have to do. There's nothing you have to try to fix. There's nothing you have to try to change. There's nothing you have to do. So you can just be with this. You can be okay with this because you are okay right now. You are okay right now in this moment. You just don't know it yet. I always like to tell my patients, I go, you're okay right now. Your nervous system and brain just doesn't know it yet. It just hasn't realized that you're safe, that you're not threatened, there isn't danger. It hasn't learned to calm down. And so we just need to work through the reasons why the brain and nervous system are not okay. Why are they not okay? And that's the psychological side that we work through in treatment. But it starts with this notion of trying. You just got to stop trying. There's nothing to do. Just stop trying and move to the state of being, which is a state of openness, a state of acceptance, a state of living your life right now because you're okay. So take this message, see if you can catch yourself when you're trying to do anything about your condition, when you're trying to fix your symptoms, you're trying to make an effort. See if you can just drop that and move into this relaxed state of being open, of being okay with what's happening, because it is okay. It is absolutely okay right here and now. Thanks, everyone. If you have anything, to reach out to me with questions, concerns, comments. I'm here to help as many of you as I can, to help people out of suffering, out of pain, out of other chronic health ailments. And we'll talk to you soon. Bye bye.